Hi, I'm Ellie Deutsch with Garrett Popcorn Shops here at Social Media Strategy Summit Chicago, and we're interviewing Janelle Logan this morning to hear all about her social crisis and escalation strategies from her discussion this morning. So Janelle, can you tell us a little bit more about yourself and how you got to Social Media Strategy Summit?
I'm Janelle Logan. I'm the Director of Community Engagement with Spectrum Health in Grand Rapids, Michigan, and I direct social media as well as community relations. And we've had almost every kind of social media crisis I think that you can imagine. So I brought those examples with me and the strategies and plans that we've developed to handle them and presented them this morning at the conference.
So can you tell us a little bit about your, session and what you divulged into about different strategies or methodologies that you guys use at Spectrum Health to help you adapt to those crises when they happen?
Yeah, I talked about the preparation for social media crisis planning, sort of defining what's a crisis for your brand. For us, it's anything that presents a threat to the brand's image and reputation, or anything that represents a true emergency, if there's any threat to human life, to the community at large. And then I presented how you would build a crisis management plan from the preparation stages, cultivating your reputation, to having the policy in place, the procedures and protocols, to the planning, how you would monitor and listen, and then the actual response, detailing the severity index, how you determine how to handle a particular incident, and then what response mechanisms you use from there.
So what type of protocols do you guys have in place for, seeing crisis, escalating it to the right team or, department, and then continuing on from there to handle with the consumer directly?
We have protocols for all of our social media staff and then our social media ambassadors in our community hospitals. And it ranges from something that can be simply an acknowledgement. So we have standard responses ready to go for those that can be handled through other departments like patient relations or patient finance, up to a custom response that requires a little bit more cross-functional involvement with other team members, to escalation where you'll determine, okay, this is something my upline needs to know, this is something that the PR team needs to get involved in, and then all the way up to emergency where you are trying to determine if you're working with law enforcement, if you're working with outside media, and how you're going to activate a dark site, for example, and let the community members know how you're responding and handling an emergency.
So with all the different crises that come about for you guys, how do you handle it internally? How many people are on your team, and what's the best methodology for you guys to make sure that you can adapt to it in as quickly amount of time as possible?
We have basically 2.5 full-time staff at the corporate office, and I say half because I manage the social media team as well as traditional community relations, so my duties are diverse, and so we have split up who's monitoring and listening, and then it's shared throughout the marketing communications department, so other folks are also letting us know if something's sort of brewing and bubbling, we might expect something to happen. We have after hours and weekend coverage schedules established, and then we also have our community hospital members of the ambassador team that are letting us know if things happen and if they need our involvement, and rising up to the corporate office, and then we can help them from there.
So with a lot of your responses, do you have a document that you've built in-house that you refer to for different types of things that you need to respond to, or is it, every situation is unique and different and calls for a different strategy or reaction?
We have crafted a number of responses in advance because there are some that you would say are more typical. So if someone has a bad experience in one of our facilities, we have we're sorry you had a bad patient experience and we would like you to contact patient relations. We help them get connected to those folks. So there are probably 5 or 6 standard responses that we have ready to go. If it falls outside of those guidelines, then those are custom responses, and then sort of the funnel sort of narrows as to who's authorized to give those custom responses. And as the funnel gets narrower, it goes sort of up the food chain, and the narrowest responses then come to me as the director.
So can you give us an example of any recent crisis that happened that, maybe just a broad overview and the steps that you guys took to alleviate the issue?
We had one recently, an unfortunate situation, a patient who felt that he was not getting the care that he needed, and we were going back and forth, starting out with some standard responses, but as that kept going, I felt that his responses really indicated he might be at risk of suicide. So I reached out to some of the senior folks in patient relations. We coordinated with administration from a community hospital where we thought he was located, and through a cross-functional effort, we did reach out to law enforcement. They were able to go and conduct a well check on the individual, and by the end of the day, we determined that he was safe and that he was getting the care that he needed. We got him a path into the care that he was really looking for.
That's excellent. You got to feel good about making sure that you're helping people and doing that through social media, which is so cool now that we have that medium. So any last tips or tricks for people, whether it's in healthcare or just overall creating your crisis plan and escalation protocols?
I would say start now, assume that there will be a crisis, be ready with some standard responses. Try not to do what I did, which was learn every single thing along the way. But reach out to your colleagues, work with PR especially, because they're very accustomed to working in the crisis space, and get things down on paper, get your staff trained, and use whatever tools that you can to have things in place so that it's easier to respond with a cool head during a crisis.
Excellent. Thanks so much for your time, Janelle. Really appreciate it. We have Janelle Logan with Spectrum Health here at Social Media Strategy Summit. For any more information, you can go online, socialmediastrategysummit.com, and check out more videos here from Chicago. Thanks.